Hello, everyone, and welcome back to the Hobo Thinga podcast. My name is Crystal Cedino, and I am the Training and Development Manager for the Native Learning Center. I am so thrilled that all of you are tuning in for yet another episode this week, so thank you so much for being committed to us. With me today, I have my right-hand lady, Cora. Go ahead and say hi, Cora.
Hi, everyone. I'm Cora Anthony, the Training and Development Specialist here at the Native Learning Center.
Yes, so we're excited for this episode today. We've been working with Indigenous Pact, what you guys don't know this, but all week. These episodes are going to be released, gradually, but we're excited to discuss this week's topic, which is going to be case studies. So highlights, of Indigenous Pact work through case studies, essentially. But before we get started, let me introduce a new crowd because we have been working with different individuals, and it's nice to see some new faces. So with that, I'm going to introduce Mike Plaisance, who's VP of Regional Operations. And go ahead, wave, Mike, to the crowd. Awesome, thank you. And then we also have Keith Novensky, who's VP of Consultancy. Go ahead and wave. Awesome. And then we have Rose Bear Don't Walk, who's consultant with Indigenous Pact. Go ahead and wave. Awesome. Thank you all so much for joining us. It's always so nice to have multiple guest speakers on one episode. So we definitely appreciate your time. All right. So as I mentioned, today's topic, we're going to be sharing some highlights of Indigenous Pact's work through case studies. And I'm just going to go ahead and shoot off the first question. With that, can you share a bit about your background and what brought you to IP Indigenous Pact?
Crystal, Cora, thank you for the opportunity to be here and really kind of share some of the work that Indigenous Pact is doing and how we can kind of partner with Native tribes throughout the country and kind of create some momentum on different things. So my background, 30 plus years working within kind of healthcare systems, cut my teeth in medical as a kind of first responder, EMT, and a firefighter when I was younger. And then kind of worked my way up through kind of hospital systems from, emergency medicine through primary care, through oncology. And really in 2017, I was actually sitting in a entrepreneurial pitch session where Kurt Brinkus, CEO of Indigenous Pact, was actually starting up this kind of company, Indigenous Pact. And he was doing a pitch because he was looking for funding. And, he started talking about his own story and his story about really how he, even though he worked within a healthcare system and actually was a CEO of numerous healthcare entities on the way through his career, couldn't actually get healthcare for his children without going to a IHS facility, which was hundreds of miles away. And I'm sitting there kind of in the audience going, does this really happen? I've done a lot of traveling, have been in healthcare my whole life, and this access issue. So I said, want to learn more about this. And then found myself, as he started talking about how he wants to bring people together and actually touch hands and make a change, create access for Native Americans within healthcare, create sustainable economies for tribes. I'm like, that's the guy I want to work with. So 6 months after that, started working for him, and it was great. And so my passion is around bringing healthy and really trying to think about how do we create healing spaces when we're doing care for individuals and care for tribal members, and long background in process improvement, lean, and process flow stuff, but also within well design. So that's my story. That's how I got here. And I just love working with this team because we support each other every day and make it better. And I'm kind of based in the Midwest. So
awesome.
So Mike Plaisance, thank you for having us here. Very excited to talk about this. So I've been doing behavioral health since about 2002, so coming up on 20 years here. I ended up doing this work kind of as an accident. I was actually a client, definitely have a passion for the work and believe in the work, behavioral health services. And I believe that it works, and I believe that everybody comes through the door could eventually take my job. and that's kind of part of that goal is helping people. And a big issue I have always seen is accessibility to services. And with IP, that has definitely been a big focus, and what drove me to Indigenous Pact was the strong focus on accessibility and quality care. And so I have a lot of history working in different modalities: residential services, outpatient services, MAT services. And so this just seemed to be the right time, and it has been a great experience helping the community.
Awesome. Thank you.
Mhm.
And last but not least.
Yeah, so hi everyone. My name is Rose Bear Don't Walk. Really excited to be a part of this podcast series and just highlighting the awesome things that Indigenous Pact is doing. I was brought on to the team a couple years ago. I was doing my master's at the University of Montana, and prior to that, my undergraduate degree was really focused on the political, social, and economic inequities between Indigenous peoples and their traditional food systems, and as a result, some of the chronic health issues that we see that are pretty prevalent in Indian country. And so I was very, very interested in how to make an impact on Indigenous health and wellness, and also kind of reconnect with those food systems to bring about that culture of healing and healing the people. And then when I transitioned to my master's, I was a little bit focused in ethnobotany, which is the study between the relationships between people and plants. And I was studying food plants at the time. So really a lot of my core work is around foods, traditional foods, health and wellness, also Indigenous concepts of what it means to be healthy and well. And I went to like a graduate student mixer or something, and met a guy who worked in the medical facilities in Missoula, Montana. And he was like, oh, like I was telling him about my work, and he mentioned something about Indigenous Pact, and he was like, yeah, I think your ethics and core values are really aligned. Let me get you in touch with somebody I know from there. And then I, talked with some folks at IP, and they brought me in specifically because they were starting to do some work with food sovereignty in a tribe out in Washington. And so it was just a very lucky moment for me to be a graduate student and finding work, but finding work that is meaningful and has an impact in a lot of different areas, in healthcare, community health, wellness, things like that. So just really happy to be a part of this team.
Awesome. That whole plant-based thing reminds me completely of Cora, because she's super duper into like all natural and everything. It's amazing. So that's really cool. But yeah, thank you guys so much for that and introducing yourself. Let's talk more about some of the work that you guys have done. We've heard of the We Care Daily clinics, and we were wondering, can you share with our listeners what they are, how they came to be, and how they function and where they're specifically located?
Yeah, well, this is Keith. I'll start off with that and kind of move into kind of where this all came from. So We Care is a clinic that was developed in partnership between Indigenous Pact and the Muckleshoot tribe out in kind of Washington State. The clinic itself was a response to a crisis that was happening on the reservation. The watershed moment, we're having tribal members dying from opioid overdose, substance use disorder issues, people going to treatment and going to inpatient stays, coming back to the same situation that they left, nothing really changed. And so through some of the work we were doing with the tribe, with the Muckleshoot tribe on healthcare transformation and revenue cycle management, we started having these conversations about, so how could we really do something about the opioid crisis? The tribe itself has a really well-recognized behavioral health, mental health program. And they were also doing medical clinic-based substance use disorder treatment. But they were only able to serve a small population of their their tribal members, right? And so we know large percentage of people live off the reservation. That's just kind of how things are. So we started going through this iteration of what could we do, what would it look like, and we came up with this concept of, so what if? The question was, what if and could you do it? Create a substance use disorder clinic that treats, opioid treatment program off the reservation that serves natives and non-natives. What would it look like? We figured it out. We kind of got the puzzle pieces together and mapped it all out and said, let's give this a shot. Let's talk with state and federal policymakers and agencies. Let's talk with Indian Health Services, and let's do something that hasn't been done before. So that was the antithesis of it. We got it. We actually built the clinic. We opened the doors and started seeing clients. And I think it's been very rewarding in the past 2 years that the clinic's been open to see the lives we're changing and to really know that the work we do as a whole from Indigenous Pact along with tribes is making a change. We're seeing a change. We're feeling it. We have great partnerships and support from the city of Auburn, which is adjacent to the reservation. The mayor is behind us in that factor. And so that really makes me feel good at the end of the day. And Mike can kind of talk more about the details that happen within the space and place. I can also answer questions about what we did in the design and the structure that's different than other places.
Absolutely. Yeah, Mike, go ahead. I was going to say, one comment I was going to make was, I bet it was nice to have the mayor and, like the state kind of like backing you guys up so that you can, move forward, because it's not always the case in certain states and cities and so on and so forth. So, but yeah, Mike, go ahead and tell us more details and so on.
Yeah, no, there's definitely been a lot of support, which is great to get that support from the community, because not only are you, trying to help individuals, but you're also often battling stigma and other things that really inhibits access to services. I've been doing behavioral health work for a long time, and the thing I immediately saw with Indigenous Pact and We Care Daily Clinic is the focus on accessibility was just different. The program's not afraid to just try things and expand things. And not everybody always understands why it's such a big deal to me. But when I first walked up to the clinic, there's dog houses out for, like, nice, kind of like you can put your dog in this thing and it'll be safe for a moment so you can go in the clinic. Most people would be like, why do you have a dog house out front? But that is actually something that prevents a lot of people from accessing services. And so there was just very much an attention to detail. It's to what actually, it's not always just about people don't want to go. There's these things that keep coming up. So a focus on transportation, a focus on hours. We do hours that are outside of the norms of anybody else, so more expanded access in a number of different ways. And I believe those are, if we need to do something different, I mean, those are the things we need to look at. And the clinic really did kind of break the mold with what traditional similar services do in the state. And we've seen a lot of success with that, and have been getting a lot of really good feedback from the community and people we're helping. And we just continue to kind of iterate and take a look at different things we can do to expand that access to service.
No, I completely agree with you. I think of my own experience. I'm one that I hate going to clinics or to the doctor or seeking any type of help, exactly because of what you said. Sometimes the hours just don't work. And it's like, I'm working when you guys are open. And so I know that Native American communities are grossly underserved normally. So adding, like, meeting the needs of the community is something so integral, so important, that it's amazing that we can start creating facilities like this one to kind of expand and provide more healthcare. So no, thank you so much for sharing that. I do appreciate that. And it brings me back to, like, the conversations that we had with the other team about, I think, Crystal, you kind of touched on it a little bit, but it's nice hearing of what can happen when all levels get on the same page and decide to work together, and then you can create something as nice as at these clinics. Because a lot of the conversations that we've had so far, it's about like, how can we get the federal and the states and the cities to like coordinate and work nicely with the tribal councils and the tribal governments and whatnot. And so this is what can happen when everybody gets along and everybody plays and supports each other, because in the end, it's the tribal communities that matter, and that's what we're really trying to build. So, while staying on this topic, right, can you tell me some of the successes that the clinic has faced, and then also some of the challenges that it may have been faced with?
Yeah, I'll probably start with some of the challenges. I mean, it's uh, items like transportation. How do you get people to services? How do you make services accessible as possible? So transportation was a big issue that I feel like we've had a lot of success with, and kind of building that in. So identifying areas like this that are really key to the overall program and have to be innovated and developed at the same level you would develop the clinic. So it's really understanding the importance of that, which honestly I think at first because with my background I would think of something like transportation as this kind of additional kind of thing that helps, but no, it has to be, it's just like just as important as everything else you're doing, and has to be just as functional. And so we pay we've had success in paying attention to those details, and supporting them consistently, and continue to kind of innovate and build them. So the transportation piece really hits kind of both the challenges and successes there.
I love that, because I've been out to Indian country and things are not around the corner the way that they are, like, for example, in my area or where our offices are located, which is Hollywood, Florida. But yeah, no, it is incredibly important that you make that accessible, just so that they can go ahead and access those, resources and so on and so forth. Not to jump off topic at all or anything like that, but Keith, you mentioned the architecture. I'm actually like really curious about that.
Yeah, so thanks for the question. That fills my heart with joy. Just to be honest, I love talking about it. We got 2 hours here. We can go for an extra time. But really, when it comes to space and place, so we had this concept. So I personally went out and started doing research on how are people treated within opioid treatment programs, substance use disorder clinics. We were in New York, we were in Washington, we went through the Midwest. And we really started seeing that. Personally, I was seeing things that are very institutionalized, very feels more like a correctional facility than it does Warman Health Clinic. As Mike said the other day, the furniture, if you can't spray it down with a hose and it's not plastic, it probably isn't in the center. And that really irritates me, because it needs to be a place where when somebody walks in that front door, because they're making a change in their life. They're saying, at this moment, I want to make a change. I don't want to be on the opioid train anymore. I want to change my life, change everything else. So when they walk in that front door, they need to immediately know, I made the right choice. This place is where I need to be. So when we look at colors, when we look at furniture, the furniture is comfortable. It's made to be sat in. It's not rigid and hard. The having like wooden clouds coming down from the ceiling creates a little space and place of comfort. We infuse the space, removing kind of those traditional, I'm going to say, heavy glass barriers between the patient or the client and the staff. And so we were really kind of thinking, what if we could make this different, bring the humanity back to the care and treat people like we would want to be treated. So that's where we came up with, the doghouse was one of those pieces. And so give a little shout out to Dog Spot. They do amazing work around the country. They actually donated 2 of their dog houses to us so we could have them out front. So when people come there that have pets that can't come in the building, they have a safe space for them. And they're pretty cool. They have an app, you can watch the dog on your dog or cat or whoever on the phone that they're in there. They're heated and air conditioned, so they're safe and comfortable. Little elements, bringing back being able for someone to come in and do a self check-in before they see somebody. Because this is a pretty personal experience you're going through. Those elements, when it goes into having like consult rooms where we're doing, one-on-one sessions with a provider. A lot of times when we go see a counselor or a therapist, we go to their office and we sit in a chair in their office and they have all their stuff on the wall. And it's like, this is their space. So we created one-on-one spaces which are neutral. It's your space. Remove that. You meet in a neutral space. You have a great conversation, and it's comfortable, and it's more of a living room setup. That's kind of how the architecture really changed, and little things we did. So I'll kind of stop there. Ask questions.
You're like, I could go on forever. Go ahead, sorry.
No, I was just gonna say that I would love to keep hearing about it because so my mom was a nurse, so I grew up in a hospital. So most of her night shifts and whatnot. And one of the things that I admired her about her craft the most is that she always went above and beyond to make people that were in her care feel like you're the only one in the room. I care about you. I care about your well-being. But the structure of the place didn't feel like that at all. Like the white walls, the cold, the cold ambience. It's very like get in, get out type of thing. So I'm hearing you, Keith, describe it. I'm a very visual person, so I'm like imagining the clouds and everything. I'm like, I want to visit that facility. Like I want to see it in action. It sounds so warm and welcoming. So no, talk more, please. Tell us more.
And it does play a big part from a clinical perspective. When you access behavioral health services, typically you don't feel like you're on a winning streak. I mean, things typically aren't going that well. Maybe some people are mad at you. And it's and so the environment you walk into, you're very sensitive to that, and how people approach you, how this place feels, and if the place feels good, it looks good, people start to think, well, I'm worthy of getting better. I should be, I deserve to be here. This is awesome. It makes a big difference on that initial engagement, which has a big impact down the road. So not only the staffs, how they approach individuals and interact with individuals, but that environment plays a big role in this. And Keith does an amazing job with it.
Yeah, I think that our experience, especially, with Keith and all of the people at IP that are really design oriented and kind of have this clinical perspective, it's really important to have those kind of ideas about facility design and how things work and how we can serve the patient in the best way possible. And that is something that can be applied to any clinics that people are wanting to build or improve upon in Indian country. Because, I mean, I grew up on the reservation. I grew up going to IHS. Like, I know that those facilities they could have a little bit of improvement. There are some things that, if you want to go to your appointments, but you're going to a place that's kind of sterile, maybe it's kind of cold, it's not like, the best environment. How often are you actually going to go to your appointments? How often are you going to put your health in those spaces? And so when we think about warm and welcoming and nurturing spaces, those are the kind of spaces that Indian country deserves. We deserve to have healthcare facilities that feel warm and nurturing, that we feel comfortable going into to seek our own healthcare and health and wellness. And so, the things that Indigenous Pact are doing with design and facility incorporation, is incredible, because I could just see that in all clinics across the nation, and people would be going to their appointments, and it would be great. We would have healthier citizens and healthier communities that are coming together to do that.
No, I completely agree with you. I think The human component to healthcare is so important. It's so, and sometimes it's overlooked. It's like, do we have the facilities? Do we have the resources? Okay, let's go. But that human component, and especially with people that are dealing with like opioid use and whatnot, that like you guys have mentioned, they've been marginalized. Like, you know what I mean? It needs to be welcoming, and it needs to be a safe space more than anything. So no, thank you for sharing that. I wish I could go visit that facility at some point. Those clouds sold me, Keith. I'm still picturing the wooden cloud. I'm sorry.
It's
But
the dog houses for me.
I,
I'm like, there are puppies outside? Like, what? Yeah.
no, well, we'll appoint you, Crystal, as like the official puppy sitter while everybody's getting like taken care of and whatnot. But to kind of switch gears a little bit, right? You kind of mentioned it at the beginning, Rose, and I want to pick your brain about this because I'm very big on food sovereignty and whatnot. So can you share with us a little bit about your work? I know you worked with a tribe in the Washington state and whatnot. Can you share a little bit about that with us?
Yeah, absolutely. I think just to explain to viewers, and maybe getting more people out there engaged with food sovereignty. So food sovereignty is this concept that Indigenous peoples or groups of peoples can have access to healthy, nutritious, and culturally relevant foods. And historically, we've been assimilated. We've had different food structures imposed upon us, and we've transitioned from these very traditional healthy food systems to these kind of new westernized ones that our bodies aren't very well adapted to. And so food sovereignty works to combat that. And it's really an incredible concept because it can be applied in whatever manner that a tribe or a person or community sees fit. So that's the sovereignty component. And when we were asked to work with food sovereignty with the Chehalis tribe in Washington, it was an endeavor that took a lot of different elements and a lot of different pathways, because that's kind of how food sovereignty could be. So we went in, we were looking at kind of what was available in the area, sort of doing like this food assessment. Where are people located? Where are the places to get food? Are there growing capacities? Are there farmers markets? What's kind of coming into the community or what's being produced in the community? And those are kind of the base level for understanding, what is the food system currently? And I think really at the core of it, why they asked us to come out there is because they were seeing those health issues being very prevalent, and also just like the fact that they had to drive a certain amount of time to go to a Costco or to go to like get organic groceries or something like that is a very salient point, I think, for a lot of Indigenous communities because we're so rural based, and it's hard to drive somewhere and get our food rather than just like going to the gas station and finding, what's readily available, what's easy and what's cheap. So, and it's really great for us to be able to travel out to these communities because I don't think you can really get a sense of how everything feels, what the people are like, what the food system is like, what the general tribal structure is, unless you go out and visit those people. And it also helps develop a relationship. And so I think that's very important when you're working with Indian country because relationships are super important. And so, kind of after we did that baseline assessment, it was kind of just like approaching all the people that, were involved with the healthcare system or tribal council members, cultural members, and saying, what do you see as food sovereignty in your own community? And then, from the responses we got, we had a variety of different topics that we could have solutions for. So there was like solutions for environmental concerns. So like fisheries, how do we improve the fishery and the waterway systems so they're not like picking up any toxins or anything like that. That's one environmental piece where you could enact change in the food system. Or there's, like what do we think about taxes, like having taxes on certain types of food, or producing food in these areas that are not being used right now. What's the capacity for an orchard? What's the capacity for buying things for the boys and girls clubs or the after school programs, or getting them into school? So like we have all of these avenues, and we just kind of presented them with those choices, so they could have, some sort of autonomy and whatever they saw fit and applicable and feasible within their community for food sovereignty.
Yeah, no, I think that's so important because so for a long time I lived in what's called like a food desert, where we had to drive an extensive amount of miles to just go get anything worthwhile. But near my apartment at that time, I had so many fast food chains and whatnot, and a lot of people don't recognize that, like, you are as healthy as what you're putting into your body, right? And so I can only put into my body whatever's accessible to me. So it's so important that we create this culture and this mentality of I have to take charge of the food that I'm growing, that like how well is it being harvested, like how organic is it? And I know organic is a big thing because it's a lot more expensive and whatnot, but it's giving you so much help on the other end, you know what I mean? So like Crystal said at the beginning, this is something like I'm very near and dear. I grew up with a backyard full of legumes and yams and tomatoes and whatnot, because I was raised to grow our own food, even though we had a small little space. And that's why I value it so much, because I know what it's like to just have fast food and like a lot of unhealthy options nearby, and I see firsthand what it did to my body and my health and whatnot. So no, I think that work is so powerful and just so important, especially in Indian country, that a lot of the reservations, like you mentioned, are so distant. And so it would give so much power and self-determination to be like, no, grow our own things. So no. Crystal, go ahead.
Yeah, no. So I was just going to ask, because you listed a couple of things that, you gave them, the Chehalis tribe, on options. What specific ones were actually like implemented, if you don't mind me asking? Yeah, sorry, I don't mean to put you on the spot. I was just curious.
Yeah. Well, let's see. Keith, do we?
So where I'm gonna kind of add a little color to this conversation is that, so we presented, COVID came around, and we all know what happened as soon as COVID happened. We closed a lot of reservations, took care of ourselves and our people, first and foremost. So that was really the what happened a lot with that work. So the recent conversations have been now, how do we start enacting that stuff? How do we start using food as medicine for chronic disease prevention? And that, to me, that's a whole nother really fascinating approach. Native foods for chronic disease prevention. Well, it totally makes sense, right? Because everything we used to grow was organic, because that's just how we grew it. It's just how it was. So how do we get back there? And so now the conversation with the Chehalis tribe is, how do we develop this kind of food program that also is incorporated with their health and wellness clinics and programs? So ongoing conversation, still moving, just took a year and a half to get to the next step.
No, that's completely understandable. I mean, you're going to have to start somewhere at some place, but it's great that these ideas are being brought to the table, because like I said, it's where you start, you know what I mean? That conversation and whatnot. But no, I do love the idea of using food as sort of like a medicine and whatnot. And like we've already said, like Cora's huge on that. So every time I'm like, I have a tickle in my throat, she's like, some ginger, lemon juice, and whatever else. So I'm like, okay, all right. But yeah, no, that's amazing. It's great. All right, so With that, let's go ahead and I guess wrap this up. Keith, can you talk about some of the other consultancy work that IP does with tribes, such as, feasibility studies and financial management and so on and so forth?
Yeah, so some of the other work that we kind of are engaged in with tribes is, so somebody has an idea or has a concept, a vision, right? So what if we wanted to do a dialysis program on the reservation to serve our people? It's just a question, right? Is it feasible? Is it a good business decision? Are there partners we should be partnering with? And so coming to Indigenous Pact to say, hey, can you bring your policy people? Can you bring your financial team, your design people, have them look at this topic and give us advice? That's really what feasibility study is all about. It's about how do we take a concept and unpack it a little bit, look at it from different angles, and give you, as Rose would say, the results so you have the autonomy to make a decision. So whether it's dialysis program, whether it's we're thinking about, we've outgrown our current health facility. How big of a health facility should we build? Can we make it financially sustainable? If we build something really big, but we can't pay to keep the lights on, that's going to be a problem. That's going to just create more stress. We don't want to do that. So in that realm, numerous ways, whether it's new buildings, whether it's new programs and services, whether it's uncovering federal and state policy, and you guys have talked about that in another episode, so I'll let you go with that. A little teaser for another episode called Listen In. But those are some of the kind of really the things we do ongoing. And then really kind of, whether a transportation program or elders transitional housing, something along that line. So really that kind of feasibility background work.
No, that's fantastic. Did Mike or Rose, did you have anything you wanted to add, to tie that out, round that out with?
No, I thought Keith covered it pretty well. Yeah, just doing what we can to help.
No, that's amazing. And again, we appreciate y'all coming on the podcast and talking about this, because I'm a firm believer that within Indian country, and we've said this on previous episodes, and I say it all the time, but if natives aren't sitting at the table, then we're left out. And if we're not disseminating information, then how are they going to know that these services are out there? So that's why, I love this podcast, and I love that Cora made the connection to Indigenous Pact. It's amazing, and we appreciate all of you. So just thank you so much for being here. All right. Well, that brings us to the end of the episode. So thank you, Mike, Keith, and Rose. We appreciate all of you being here today. Our listeners, we hope you enjoyed today's episode. Definitely something that we are happy to be putting out. And we hope that all of you keep tuning in for future episodes. If you enjoy the show, please rate us on Apple Podcasts, Spotify, Google, and visit our website, www.nativelearningcenter.com, to find information on upcoming webinars and virtual trainings. Be sure to come back for more content. Until then, bye.